2 kids. We actually just moved to Canyon City. The sense of community has been amazing.
Okay, now I'm ready.
Parker sees several people at this office.
The post provides pediatric care, wellness checks, immunization. We have a dental hygienist that comes Tuesday afternoons, and we're right connected to Canyon City Middle School.
A school-based health center is a comprehensive, high-quality clinic that is inside of a school or on school grounds.
Kids First Healthcare is a group of school-based health clinics across Adams County and extending into Brighton.
Hi, we have an appointment today.
And then we have 2 community clinics like this one where we see the greater community.
Hear your heart today, it sounds so big. It says boom, 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 boom.
It's really important to make sure that we're able to improve access to care and be able to do it in a convenient and comprehensive way.
A lot of times rural communities miss out on medical care and behavioral health because the services or transportation's limited. So if we're able to provide that right here in Canyon City next to a school, and elementary school's not too far away, the high school's not that far away.
We know that if they're not in good health, that affects their school performance. Westminster Public Schools is one of the districts that has the students with the most need. That's why we're here.
Highest needs communities are communities that over time there's been unequal investment in those communities over others, so their health outcomes tend to be worse. It's really important for us to learn that history and context of why and make sure that we can work toward making things more equal.
This is just how to make a smoothie. This is something very simple.
Colorado Association for School-Based Healthcare, or CASBIC, is here to advocate on behalf of school-based health centers and also offer fundraising and quality improvement supports.
We are a collaborative partner as Kids First Healthcare with CASBAC. We work together to be able to continue to build our school-based health program and to share ideas and collaborate with others and really bring the most evidence-based care to our clinics.
With COVID, we've seen an increase of anxiety, depression, suicide, so it's more important than ever to connect with families, either telehealth or through an outpatient office.
Before the pandemic, we only had 2 school-based health centers that had telehealth. All school-based health centers were ready and adapted quickly to the changing circumstances. I was so impressed by their commitment during the pandemic. I'm fortunate to be working with such a collection of amazing individuals every day.
During the pandemic, we have closed several clinics that are inside schools because schools haven't been open for kids, which we know if they're not able to come to school, they're not able to get their medical care. We worked with CASBAC to be able to serve these kids.
As of 2021, we have 69 school-based health centers. We do recognize that we have gaps in school-based health centers in eastern Colorado, the San Luis Valley, and northwestern Colorado.
Just breathe normally for me, okay?
The school-based health centers receive revenue from the state of Colorado. We also have done a lot more work around advocacy and making sure that state funding is there.
We serve as their medical home. I really get to know the patient and the dynamic of the family on a much deeper level, which in turn helps me understand how they can overcome any obstacles that they might have.
And he's here following up with his asthma.
When I call, the receptionist knows me, and Parker knows everyone at this point, so he's comfortable with everybody. It's just really nice.
And if you don't have one in your community, make it known to your legislator that you want one in your community. We can make some real progress in Colorado in reaching the corners of the state that we haven't reached yet.
I just hope that it can continue to be expanded because this is a service that really could benefit any child.
Thank you.
Oh, thank you. You're so welcome.
It's nice to know that I've got people and they're on my side. They genuinely want to help.